This is what every healthcare worker, healthcare professional should know. You must remember, I created these videos so that I help healthcare practitioners navigate the various health-related acts in the Republic of South Africa. So this is, it's actually two things. These are the two things that every healthcare practitioner should, must, and has to know. One, you must write everything down. You must write everything down. You must remember, when you are interacting with a healthcare user, formerly referred to as a patient, when you are interacting with a healthcare user, any information that you get, any information or deduction that you reach after a clinical examination, write it down, because you are creating what we call a body of evidence. This is something, it's a trend I've noted. Many healthcare practitioners will conduct a physical exam, and instead of recording the results of each and every clinical assessment, they will just write this sweeping statement that says clinically stable, examination unremarkable, something like that. Unfortunately, there is no such a thing as a clinically stable assessment. When you say someone is clinically stable, you are referring to an outcome of a number of tests, right? So write those findings down. If you feel that the heart rate for that patient is within a normal range, write that down. If you feel the respiration or whatever clinical assessment that you conduct, every finding that you get, write it down, because you are creating a body of evidence that if something happens, a safety incident or an unfortunate incident, maybe the healthcare user passes away, you are able to go back to your notes and you are covered if you are taken to court. Stop that tendency of clinically stable. There is no such a thing. The clinically stable is an outcome of numerous tests, and the results of those tests need to be recorded. That is the first thing. So write everything down. That is the first thing that you need to know as a healthcare practitioner. But the second most important thing is that you must ensure that someone else can read what you have written down. Unfortunately, I see situations sometimes where someone cannot, when you have a hearing or something like that, and someone cannot read what they wrote down. So you see that this person is now struggling to read their own notes. So when you are recording all of these assessments, all of these clinical tests, make sure that your handwriting is legible. Basically, the founding principle or sections of the South African law which deal with this issue in the main, it's actually a couple of sections. Section 13 all the way to section 17 of the National Health Act deals with record keeping. So if you forgot everything that I just mentioned in the last 5 minutes, remember this. As a healthcare practitioner, You must write everything down. There's no such a thing as a clinically stable physical examination outcome. What you are expected to write is to write all the findings of the various clinical assessments that you conduct. Secondly, make sure that your handwriting is legible. Please remember to like and subscribe. Thank you.